All right, last but not least, let's take a look at practice management graphs. So unlike patient graphs, which are just showing you graphs specific to the individual chart that you're working on, the graphs in practice management are intended to look at your whole practice. So this is really fun. For example, let's say I have a patient and they're on an advanced program. This will generate a graph of weight loss for all of your patients on all meal plans. Or you can filter by any specific meal plan. So for example, we can filter by advanced. And then it'll show you the weight loss figures just for that program, days on the plan, and how much weight they've lost. Or you could filter for patients doing it for the first time. Remember, program numbers, you might want to filter out patients on their third attempt at weight loss and just look for patients that had their first attempt. So a quick way for you to take a look at your weight loss by meal plan. The other graphs work similarly. We can look at total weight loss for the practice. So you see days on plan and the weight loss. We see average weight loss, and then we have it fractionated out by meal plan on this. So this graph can be confusing because they're all overlapped, but let's turn off some of them. You can just click and turn off your different meal plans. You could just look at one, or you could overlay. So this is a view that would allow you to see how does an OptiFast program compare to an exchange program and see if it's better. And we might say weight loss greater than 0 would filter out all of these 0 numbers. And give us a better view on that. So again, I'm in the process of tweaking these graphs, but that's a practice-wide view graph for weight loss. Weight loss by medication is kind of neat. You can look and see how your patient's weight loss is on the different medications that you dispense. So again, there's too much data here, but you could turn off most of them. Suppose we want to compare weight loss with phentermine and tenuate. You could look and see if you have better weight loss with one drug or another. Same thing with percentage weight loss, and a graph looking at what medication actually was dispensed. We could filter this down just to people that lost weight. Which will eliminate a lot of the data points. Or we could filter it down by meal plan or weight loss program, or which medication we're using. So we could say medication contains phentermine, and that'll just show you the different patients that are on phentermine. So now you see we just have the 3 doses of phentermine, and you could see, gosh, did people on the 37.5 capsules lose more than the people on the 30 milligrams? Obviously in this chart, gosh, we wouldn't have a lot of reason to use the 37.5s over the 30s. But this is all test data, so it doesn't really count. But this would be a really nice way for you to report on your medication use and if you have a medication that's more effective than another. We just have a view to look at body fats so that you can see how your body fat percentage trends for your patients, and you can look at how the fat weight and lean weight trend for all of your patients. Same type of table. How's your blood pressure graph doing for your patients? So let's turn off pulse, and you'll be able to see, maybe we want to say blood pressure greater than 0 so that we don't have 0 values in there in case patient weighed in but didn't do a blood pressure. So you can see that cleaned up most of that data. We can see our blood pressure trend is generally a little bit down. So that gives you a real nice look at your practice blood pressure curve. Might be something you could report on to your patients too. Gosh, how do patients on OptiFast do with their blood pressure compared to patients on a balanced diet. And so we can look at it that way, and we could see if there's any difference between meal plans, or if you're doing very low calorie diet, is that lowering blood pressure more than a balanced diet? So a real nice way for you to quickly generate numbers. Now, I should have commented on all of these tables. You can print them or you can export them. So you can export your data and do further data analysis in Excel or the program of your choice. Same type of thing. This is going to look at labs instead of just for one patient. You can say, what are the labs for the glucose doing for all of my patients in the practice? What are the cholesterol numbers doing? We could just look at total cholesterol. Risk ratio, of course the ratio of total cholesterol to HDL. And what are the liver tests doing? And this might be a neat way to look and see on a particular food plan if it's elevating liver tests, or is a food plan elevating A1C. So when you have a lot of data in here, these graphs will start to make more sense. Thyroid I added since weight loss can affect thyroid function. So suppose we did a graph of TSH and we showed that across our meal plans TSH was going up. Might be very interesting as for tracking. Then you can filter these out by lab or by weight loss program. So let's say we filtered it out by TSH greater than 0. That'll clear up that TSH graph. And it's just going to show the TSHs that were greater than 0. And just a couple other graphs in the graphs view. And again, all of these are being actively tweaked to make them as useful as possible. Diagnoses, I love looking at this. So this gives you a peek at your primary and at your primary diagnoses. So you can see how many of your patients have the metabolic syndrome or insomnia. And so these are just showing the diagnoses that we've classified as primary. And you can see how prevalent that is in your patient population. Marketing is another of my favorite graphs, just to look at your patient demographics. This shows how did patients hear about us. So are your patients coming because of word of mouth, or from a daily deal, or from their doctor, from a family, or did they find us on the internet? And so this can help you track your effectiveness of your marketing. This shows who actually referred them, so you could see if there's a particular doctor referral source that's really big. Pie graph of that same information. And then this lets you filter. So I like to look at this each month. So you could put your today's date between January 1st and January 31st, or you could filter by a specific doctor if you want to pull that out, or you could just look at doctor referrals. So as an example, let's say I wanted to look at all referrals between 01/01 2012 and 12/31/2012 and search for that. So this can tell me last year on this database I had 7 referrals, 1, 2, 3, 4, 5, 6, 7 doctors. But you could generate this graph monthly or quarterly or annually and see who's referring to you. So again, I think for marketing purposes that's very helpful. Maybe you see your referral sources and you want to send them a thank you card or a holiday card or something like that. Then gender distribution I just put in there so you can see your percentage of men versus women. And I think that's it for graphs, unless we add some more graphs to that menu as time goes on. So I hope that helps you have a good idea of how to look at your practice graphically.